Hi, my name is Kevin Rea. My team is Idiopathic Pulmonary Fibrosis. The introduction. Definition. Is a chronic and ultimately fatal respiratory disease. Is a disease in which tissue deep in your lungs become thick and stiff or scarred over time. The formation of scar tissue is called fibrosis.
I've gone underwater with great white sharks in cages. I've stalked lions on foot. I've fished guns twice. I've never felt anything as scary as not being able to breathe.
Years ago, my mother was diagnosed with IPF. It was very difficult for our family because this was a vibrant, healthy, active woman who essentially gets pretty much a death sentence.
My father had pulmonary fibrosis. I had seen him going downhill. He was on oxygen all the time. He was in a wheelchair. I saw him die of it. So when I was told I had it, I knew exactly what this was all about.
The hardest part, we have 3 kids, and calling them up and saying, I have this disease, and it's progressive, there's no cure, and I was given 3 to 5 years to live.
Well, when I think about my grandmother, I always just think about being at the cottage with her, taking us to the beach in the summer, all those kinds of things. So she was awesome.
I play ice hockey, and my dad was the manager of my team for many, many years. That was a really big part of my life and always a big part of our life together.
He played soccer with me, hockey with me, baseball with me. He would be faster than me, and then suddenly his breathing slowed down. He started coughing, having trouble going upstairs. He needed oxygen to get from the car to the house.
There were times where his breathing almost seemed to stop for a couple seconds.
Slowly but surely, there was, a lot of coughing, whether she was at the dinner table or just speaking, and, that cough would get kind of aggressive at times, and I think that's when we could, start to tell that it was getting a little bit worse.
You could tell from her face that she was hiding it. You could see her doing the breath and then turning away from us so that maybe we didn't see it.
I loved sports, I loved sailing, and was a phys ed teacher, so I could do all those things, and all of a sudden I couldn't even lift the sail on the boat.
A real small incline, just like that, going uphill, as opposed to flatter downhill. It started becoming incredibly difficult walking up a street with an incline.
The smallest things for him became the biggest things. And that was really tough to see, to watch him go through that, because the struggle for him was even more than it was for us. Even though we had more responsibility, just him not having the responsibility was tough for him.
See your wife, shoveling snow when you can't, and your sense of usefulness diminishes.
What we struggle with more is the knowledge of how IPF can end. It's a really tough ending, and to think that you just have so much trouble breathing.
I got pneumonia on top of my pulmonary fibrosis. It's a real recipe for a disaster. My breathing was getting harder and harder, and I had oxygen, but I still was struggling to breathe.
He's fearless in many ways. So when he was scared, I was scared, and I got on the phone and I called 911.
I didn't want to go to the hospital. I began to think, okay, I'd overreacted. Finally, my son came in the room. I guess he'd been just outside listening to everything. He came in the room and said, look, he said, you always wanted to see your grandchildren. And he said, if you do, you better go now.
Seeing him still, seeing him hooked up to a machine so he couldn't move, was terrifying.
There was a 2-day period in there waiting. And the whole time my son was sitting there holding my hand. And he's just nodding like this. Nodding beatifically. And I'm like going, this is wild. Because basically his eyes are just saying, it's going to be fine. You're going to be fine. He was acting as a caregiver with me the way I had with my father.
We knew that the only way for Rob to survive at a point was for him to receive a set of lungs.
He was about as sick as they get. Our average wait time for a lung is in the 3 to 5 months range. Getting a lung within 2 days is really luck.
Causes. Factors. Environmental pollutants include inorganic dust, silica and hard metal dust, and organic dust, bacteria and animal proteins. Medicines that are known to cause pulmonary fibrosis in some people include nitrofurantium, amiodarone, methotrexate, and bleomycin, and many other medicines. The following factors may increase your risk of IPF: cigarette smoking, viral infection, including Epstein-Barr virus, influenza A virus, hepatitis C virus, HIV, and herpes virus 6. Genetics also may play a role in causing IPF. Some families have at least 2 members who have IPF. Researchers have found that 9 out of 10 people who have IPF also have gastroesophageal reflux disease. GERD is a condition in which acid from your stomach backs up into your throat.
Idiopathic pulmonary fibrosis, or IPF, is a progressive and fatal form of chronic interstitial lung disease that eventually leads to the destruction of lung architecture and ultimately respiratory failure. The exact mechanisms by which IPF occurs remain unknown. Early hypotheses suggested that this devastating disease was caused by chronic inflammation that led to fibrosis. However, an increasingly favored hypothesis suggests that a still unidentified stimulus or stimuli produces repeated injury or insult to the alveolar epithelium, followed by an abnormal repair response that leads to unremitting fibrosis. Let's take a closer look. Despite the unknown etiology of IPF, several potential associated factors have been identified and include genetic predisposition, smoking, environmental dust exposure, gastroesophageal reflux disease, oxidants, and viral infections. The specific sequence by which the pathogenic mechanisms of IPF occur remain poorly understood, but are currently believed to begin with repeated injury to either the function or structure of alveolar epithelial cells. Once injured, the activated epithelial cells stimulate the release of several profibrotic and inflammatory mediators, including transforming growth factor beta and tumor necrosis factor alpha. TNF-alpha and other cytokines mediate recruitment of inflammatory cells, while TGF-beta and other growth factors stimulate the migration and proliferation of fibroblasts, which begin deposition of collagen matrix to initiate the repair process. Growth factors are also believed to play a role in the emergence of myofibroblasts from resident cells. Over time, these cells organize into clusters known as fibroblastic foci, where they continue to deposit extracellular matrix. The healing process becomes uncontrolled and dysregulated as matrix accumulates and the fibrosis becomes established. The dynamic balance between matrix synthesis, degradation, and resorption may become imbalanced, further contributing to the fibrotic process. The injured epithelium is unable to restore itself and becomes vulnerable to apoptosis or programmed cell death. In addition, the now exposed underlying basement membrane becomes disrupted, allowing fibroblasts to infiltrate the alveolar space. Conversely, fibroblasts and myofibroblasts fail to undergo apoptosis, resulting in continuous alveolar invasion and deposition of matrix, contributing to further destruction of normal lung architecture. The disease becomes more extensive due to repeated injury, each at different stages of development throughout the lung. This explains the temporal heterogeneous pattern interspersed with healthy lung tissue and the gradually increasing accumulation of matrix, unremitting fibrosis, fibroblastic foci, and honeycomb cysts that are the hallmark features of idiopathic pulmonary fibrosis. However, as our understanding of the underlying mechanisms of IPF evolves, from that of a disease resulting from chronic inflammation to that of one due to recurrent epithelial cell injury and aberrant fibrotic processes, our treatment approaches are evolving too.
The treatment. Medicine. Currently, no medicines are proven to slow the progression of IPF. Prednisone is an anti-inflammatory medicine. You usually take it by mouth every day. However, your doctor may give it to you through a needle or tube inserted into a vein in your arm for several days. After that, you usually take it by mouth, because prednisone can cause serious side effects. Your doctor may prescribe it for 3 to 6 months or less at first. Then, if it works for you, your doctor may reduce the dose for over time and keep you on it longer. Azathioprine suppress your immune system. You usually take it by mouth every day because it can cause serious side effects. Your doctor may prescribe it with prednisone for only 3 to 6 months. If you don't have serious side effects and the medicine seems to help you, your doctor may keep you on them longer. N-acetylcysteine is an antioxidant that may help prevent lung damage. You usually take it by mouth several times a day. A common treatment for IPF is combination of prednisone, azathioprine, and N-acetylcysteine. However, this treatment was recently found harmful in a study funded by the National Heart, Lung, and Blood Institute.
People living with pulmonary fibrosis often experience confusion and frustration as they try to understand their diagnosis. Pulmonary fibrosis is a complicated diagnosis that encompasses many diseases. The big picture of lung disease is vast and includes diagnoses such as COPD, asthma, and cystic fibrosis. In addition, we have a family of diseases called ILD, or interstitial lung diseases. Now, there are over 100 different kinds of interstitial lung diseases. We group these diseases together because they share two common features. One is inflammation, and the other is scar tissue. These both occur in the walls of the tiny air sacs of the lungs. Your lung is made up of millions of tiny air sacs, too small to see without a microscope. The wall of each air sac is very thin, about 10 times thinner than a strand of hair. These walls need to be thin to allow oxygen inside the air sac to move easily through the wall into the bloodstream. It's easy to take a breath as thin walls mean that the lung is flexible, and therefore easy to expand when you breathe. When scar tissue or inflammation builds up in the walls of the air sacs, the wall gets thicker, making it more difficult for oxygen to get into the bloodstream. Thickened walls are also stiff, making it harder to breathe, which causes breathlessness. Scar tissue and inflammation can also trigger cough. So what is the difference between interstitial lung disease and pulmonary fibrosis? Interstitial lung diseases include all of the diseases in which there is inflammation or scar tissue in the walls of the air sacs. Many forms of interstitial lung disease can also be called pulmonary fibrosis. Pulmonary fibrosis, however, is not a specific disease. It is a general term that refers to any kind of ILD in which scar tissue is present in the walls of the air sacs. Your doctor will work with you to figure out which kind of ILD you have. Many people know that asbestos and working in a coal mine can damage the lung. These are examples of pulmonary fibrosis due to exposures in the workplace. One of the most common forms of pulmonary fibrosis is called chronic hypersensitivity pneumonitis. This is a long way of saying that the lung is too sensitive to airborne particles that cause inflammation and scarring in the lung. Airborne mold spores and bacteria in the home, workplace, or other indoor environments and exposure to birds are common causes of chronic hypersensitivity pneumonitis. Other causes of pulmonary fibrosis include certain medications, including amiodarone for cardiac arrhythmias, nitrofurantoin for urinary tract infections, and chemotherapy for different forms of cancer. Radiation treatment for cancers in the chest can also lead to pulmonary fibrosis. People who have autoimmune conditions like rheumatoid arthritis or scleroderma are at risk for pulmonary fibrosis. Many people have these exposures but don't develop PF. Often, however, doctors won't be able to identify a specific cause of your disease. If this is the case for you, you might have been told your disease was idiopathic.
Conclusion. Living with. No cure is available for idiopathic pulmonary fibrosis yet. Your symptoms may get worse over time. As your symptoms worsen, you may not be able to do many of the things that you did before you had IPF. However, lifestyle change and ongoing care can help you manage the disease. Try to maintain a positive attitude. Relaxation techniques may help you do this. These techniques also may help you avoid excessive oxygen intake caused by tension or overworked muscles.
Pulmonary fibrosis is a set of diseases that cause progressive scarring inside the lungs. Over time, healthy tissue is slowly replaced with scar tissue, which causes airways to be blocked, restricting airflow. This makes breathing difficult and chokes off the amount of oxygen needed in the bloodstream.
Only 29% of the population have ever even heard of the term. And of that 29%, 44% have heard of the term but know nothing about the disease.
Experts do not know exactly what causes the lungs to scar in people with pulmonary fibrosis. But there's one thing they do know. What most patients experience first is shortness of breath.
Thank you for watching.